sure. The first and probably biggest advance, to date in breast cancer imaging is 3D mammography, which is called tomosynthesis. And 3D mammograms now use the digital mammography or the X-ray, but it now combines it in a fashion that is able to computer generate a moving picture through the breast. And so when a person goes for their mammogram, they'll be in compression and the machine will rotate around the breast so that we can get a fuller spectrum as opposed to just the two-dimensional top to bottom and side to side view. Now we can see layer by layer by layer by layer. And it's been really important because mammograms are based on density. And so the sensitivity of mammograms to detect densities within densities is a little bit challenged. But when we can go slice by slice, it helps us to be able to see better. So 3D mammograms, in my opinion, are one of the most important and revolutionary technologies to date. However, I think newer non-compression and non-radiation studies are emerging. We certainly use more often ultrasound. Ultrasound uses sound waves. We now have automated ultrasounds where the machine will ultrasound the entire breast without the technician. We utilize MRIs, magnetic resonance. MRIs can show us blood flow into the breast. Other advances include contrast-enhanced mammograms, so we can give dye and contrast and we can begin to combine those modalities as well. Some newer things that have come down the pike, of course, we have our PET scans, which utilize FDG or a sugar compound to look at the uptake and the metabolism of tumors. We can now couple those to label for estrogen receptors. So there are lots of new advances, and even more exciting on the horizon. I'll tell you, in early detection, we're beginning to utilize technologies like elastography, where we can now look at the stiffness of the breast tissue instead of the density. We can tell stiff breast, dense breast masses are going to give more pushback on the tissues. So there's lots of exciting things coming down the pike, which is important because, mammograms have been around since the 1960s. And in this day and age, we should be able to utilize technology to have better early screening modalities and more options for patients.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.